Hey, this is Dr. Darwin, and welcome to another episode of Ask Dr. Darwin on the New Dentist Podcast Show, where we talk about getting into dental school, getting into residency, and then life as a new dentist. Guys, be sure to continue to share this content. Only about 15% of the people that are watching these videos are subscribed. So we need some more of you to subscribe, all right? Also, comment down below and tell us more about things that you liked about these videos and the podcast so that we can continue to bring this content to you. All right. Also, this episode of Ask Dr. Darwin is being brought to you by getintodentalresidency.com. That's right. Look down below. Getintodentalresidency.com, the ultimate resource to help you navigate the process of getting some advanced dental education and also getting to board certification as a specialist. For more details, check the link down below, and we hope to see you in our upcoming training very soon. So today we have a special guest who's back after 3 years of finishing up dental school, and now he's at it again, is en route, and he's going to be talking a little bit more about his journey into oral surgery. Dr. Reed, welcome back. How you doing, man?
I'm doing great. Thank you for having me.
You're welcome. So give us a brief introduction. Tell us about yourself for those that maybe didn't watch the last episode a couple years ago, so we know a little bit more about you.
All right. So hello, everyone and future surgeons. I am Dr. Shereen Reed, a captain of the U.S. Army and current advanced education and general dentistry resident at Joint Base Lewis McChord in Tacoma, Washington. I'm a native Philadelphian, achieving my Bachelor's of Science in Natural Science at the University of Pittsburgh, Master's of Biomedical Sciences at Geisinger Commonwealth School of Medicine in 2018, Master's of Health Sciences at Meharry Medical College in 2020. I hold certificates in public health and health policy while achieving my Doctorate of Dental Surgery degree in 2024 at Meharry Medical College School of Dentistry. And I am delighted to be here today. Thank you.
But once you apply to a program and you get their attention, which is an important part with your application, then you get to the next phase and the next step, which is interviews. Tell us a little bit about interviews that you had and how your interview day went, questions that they asked related to why you wanted to become a board certified or surgeon.
Just before I get into that great question, I just wanted to say that currently the Army, I'm not sure of the other branches, they don't have any 6-year programs. And that's why they offer those routes to the civilian, those 2 routes, University of Texas, Houston and University of Texas, San Antonio for their 6-year programs. Because currently the Army only had the 4-year programs, the non-MD programs. And for me, I didn't want to do the extra 2 years and take step 1 through 3 anyway. Same scope of practice. The MD does have its privileges, but for me, that was the route that I wanted to take because I feel like once I graduate, I don't know if I want to do bread and butter oral surgery. I might want to do a fellowship, but I just didn't want to tack on the extra years and all these extra exams when for me, the most important thing is becoming board certified.
Yeah, that's key. So let's talk about the interview day, what questions they asked, and why you think they were asking some of those questions related to your candidacy to be an oral surgeon.
So one question that they ask is, they said, if you were to describe what the field of oral and maxillofacial surgery is to a family member or friend, how would you describe it? So they just want to see how would you describe and articulate on layman's terms to someone not in the medical field. And because on a day-to-day basis, you're going to have to explain everything, the intricacies of anatomy and oral surgery and just dentistry in whole to your patients, but you have to be able to articulate on a level that they can understand because they're not in the medical field. So that was one question that they asked. Another question that they asked was, what characteristic makes you different than other candidates? I think that was a pretty common thing. They just want to see what makes you stand out. And are you going to say something that's very generic? or are you truly somebody that has something special in you that's different than everybody else? So I think they asked that question. It was some generic questions. They asked, "What is your understanding of anesthesia?" That was a very broad question that kind of took me off guard, because then I had to formulate a broad understanding of anesthesia and shrink it down to a pretty much a one or two liner. And then, which is kind of not surprising, but it caught me off guard a little bit, was, why is your GPA so low? Granted, my GPA at the time was a 3.58, but in a highly competitive field, they expect much higher. It doesn't make or break you if you have so many other things to offer. But that was what they asked. And I had to explain my advances, my faults during my journey through dental school, and how I had overcame them, and how I will do things differently going forward. Because as everybody know, oral surgery, when I got accepted, they said the easiest part is getting in.
That's right. That's just like dental school. The easiest part is getting in. I know it sounds crazy. That is the easiest part of this whole entire process. Just same thing with residency. It's easy to, it's get like you're done. You got the hardest part done, so to speak. Or at least that's what you think. Nah, you got to get
No,
through now.
that CBSE was rough, but yeah, that's what they tell us. So other than that, I didn't really have any questions that were I thought were unusual. Besides, they did say why your GPA is so low, and it was at a 3.58. And so I know that I guess they expect people to have like, I'm speaking to the consultant of Army oral surgeons after I didn't get accepted last year right out of dental school, and he said the a holistic candidate is the class president who has the 4.0. Oh, wow. I was like, their expectations are very high. It doesn't make or break you as a candidate, but you just got to be able to articulate yourself and just let them know, the reasons why, even though there are no excuses, the reasons why you didn't perform as much as you did. How did you overcome them? And how will you do things differently going forward to prevent those things from happening?
Yeah, and I think that last piece you mentioned is very important, right? What challenges have you encountered? How you handled it, and did I say and what you learned from that challenge? Meaning, what was your overall assessment of that challenge, and what are you going to do differently moving forward now that you've had a chance to evaluate your actions, make an assessment, so that what you did that was challenging or hard, you're able to better handle it if it comes up in the future. Very, very important, very key to be able to communicate that
And
because not only once you get into oral surgery, and I think this is probably for all residency programs, but I think it's even more for oral surgery, which is expect to be challenged on a daily basis,
great point.
right? I'm no oral surgeon, but I know a whole bunch of them, and I know their personalities, and I've heard stories of their own training while
Yes,
they were residents, and the amount of quote unquote oral surgery hazing that goes on
that doesn't
during
exist.
that time, right? During that time or during your time, it's on a daily basis. You're gonna be the tooth fairy and or the chief of tooth fairy or surgeon dumb is gonna be hazy. You're gonna be challenged every day, confronted with something that your faculty members, your attendings are gonna challenge you on it and expect you to be able to handle it,
What I
right?
will say, that's a great point. The organizations, non-hazing organizations, first thing. But what I will say is, they will challenge you. It's definitely training, like boot camp, and they're trying to train you because it's a vast amount of knowledge, and you have to really know these things on point. You have these people's lives in your hands. When they're on the operating table and you're in the OR, you gotta make sure you know your anatomy. You don't sever the carotid artery as you're going in for certain things, certain structures, and is very critical. So the intense or rigor of it is definitely is indicated for these programs. Now, maybe should they be a little bit more constructive? One could argue that, but it may or may not yield certain results. As we know, if it's more traumatic, sometimes people associate that with remembering more. So they do make it tough for you, but it's for the betterment of yourself as a surgeon or any residency training program that you do.
Absolutely. And it's not meant to be a bad haze. It's meant to be a happy haze, right? For those reasons, right? Because you are expected as an expert and have the responsibility of someone's life in your hands, literally, right? So all of that's part of that process, and also those questions that you are expected to be able to answer and why they are asking those types of questions, right? So that's key. Applying to residency program can be a challenge, especially programs like oral surgery. There's a lot to prepare for. Doc, tell us, what was the hardest thing about this process applying to oral surgery for you?
Oh, firstly, I want to say thank you for having me. The hardest part about this process, applying the oral and maxillofacial surgery, as you know, there are many challenging aspects of the application process, such as academic excellence, standardized testing, intense competition, excellence in clinical skills, building a strong network. However, the hardest thing about this process, in my opinion, was resilience and coping with rejection. And what I mean by that is the journey can be mentally taxing, and it often involves facing rejection. Candidates sometimes need to apply to multiple programs over several years, potentially dealing with feelings of self-doubt, imposter syndrome, and discouragement. But ultimately, each part of that process is a major hurdle, but together they develop your resilience, perseverance, skills, and mindset to have a successful career in oral and maxillofacial surgery.
Sounds good. So it sounds like the hardest part really was getting to yes. And before you get to yes, you may have to get to some no's and some challenges, right?
A lot of no's.
Yeah. Gotcha. So Doc, what's the best way for people to get in contact with you if they have some more questions?
All right. Well, thank you for having me. And the best way to get in contact with me, you can message me on LinkedIn, Shareem James Reed. I'm also on Instagram, The Mad Scientist, spelled THA.MAD.scientist. And then Twitter, Surgical With It 06. And, just feel free to, if you have any questions about the process, especially if those who are going the military route, I'll be able to, guide you into the right direction.
Well, we appreciate your direction that you've given us as far as your journey and how that has directed you to your successful match into oral surgery. We wish you continued success, and we say thank you. Thank you.
Thank you for having me.
From the alpha to the omega, we making sure that you all are listening, get this information. Please like, subscribe, and most importantly, go to the next video right now. All right. Love, peace, and smiles. Go to the next video.
All right, sir.